Insulin therapy often becomes an integral part of diabetes treatment. In case of type 1 diabetes, this is the only way or mode of treatment because pancreas stops producing insulin altogether. And in type 2 diabetes also, which is the most common form, if your lifestyle changes and diabetic medication is not working, then you may need to take insulin. Also, in gestational diabetes or diabetes during pregnancy, insulin therapy may sometimes be required. Whatever might be the prognosis, if your doctor is suggesting you to take insulin, then please go with it. Many people are reluctant to start taking insulin due to some fixed notions, and there are always are so-called well-wishers who gets very much concerned and sympathetic about your insulin treatment. But here, while managing diabetes, the most important thing is to keep your blood sugar level within the healthy range so that further complications like kidney disease, nerve damage, cardiovascular disease, etc., can be prevented. And your doctor is the best person to decide what treatment is suitable for you. So always go ahead with your doctor's advice. And insulin therapy is very convenient these days because the pen pills that are available nowadays are very convenient and the needles are very tiny, which hardly hurts. So please take the doctor's advice. And once you start taking insulin, there are 5 things that you should keep in your mind. Number one, you should learn how to take insulin and at what site or portion of your body you should take and how you can adjust your doses properly with the help of your doctor or your healthcare provider. Secondly, you should always adjust your meal time according to your insulin doses. And especially if you are taking rapid acting insulin, then your meal time should be within 15 minutes of taking the insulin. And if you go beyond, delay it further, then this can cause rapid decrease of your blood sugar level. So all these things can be explained to you by a doctor, or you can always consult with a qualified dietitian who can help you in adjusting your meals based on your insulin doses. Third point is that keep monitoring your blood sugar level within regular intervals and keep a record of it, which would help your doctor in making adjustments in your insulin doses in future. And for this, you can always buy a glucometer for self monitoring. Fourth point is that you should know about hypoglycemia, or when your blood sugar level goes very low, and what are its symptoms like dizziness, fatigue, breathlessness, sweating, unconsciousness, etc. And accordingly, you should know what you should do in such condition. And you can take your doctor's advice or an expert advice for this. Fifth point, which is a very important point, is how to store your insulin properly. Unopened insulin cartridges should be kept in refrigerator in temperature between 2 degree and 8 degree centigrade. And you should ensure that it doesn't get frozen. And also the insulin that you are taking or using, that should be kept within room temperature, which doesn't go beyond to 25 degrees centigrade, or in summers it shouldn't go beyond the 30 degrees centigrade. And you should always ensure that the pharmacy from where you are purchasing the insulin also maintains that cold chain. And here, therefore, you have to be very careful while purchasing online. Insulated bags are available for this purpose. And also, if you find that your insulin cartridge is not very clear, it's looking cloudy, or you see some flakes or sediments in it which doesn't get dissolved after mild rotation, then you should not use that. And the insulin that you are keeping in room temperature and using it shouldn't be used beyond 1 month. So all these things you should keep in mind, and you should always ensure that you take your insulin in proper time and in proper dose, and also you take your meal in correct amount and in proper time. So this would help in keeping your blood sugar level within the normal range, and that way you can enjoy a healthy and happy life. Thank you.